start vaccinating children. Also talks about a shortage of the Pfizer jab. The Metro focuses on the over 18, saying that they should all be able to grab their jab by the end of this week. The Guardian reports that vaccinations are set to become compulsory for care home staff. And The Times likewise says that the Prime Minister will support plans for mandatory jabs despite human rights concerns. Well, let's pick up on that question then of mandatory jabs with our political correspondent Kate McCann in Westminster. This has always been a controversial question, Kate. What are you hearing?
It has always been controversial, but tonight we understand that the government is going to back mandatory vaccinations for care home staff that work in care homes where adults live. Now, that will be controversial, as we say, in the sector, because there are some who believe that actually it makes more sense to try and persuade people to have the jab and try and ensure that their concerns are met with people who listen to them, give them advice perhaps, and try and persuade them that it is the best way forward to get a vaccination. Now, there are some suggestions that as much as 16% of the care home staff sector are not currently vaccinated. It's higher in some areas. And there are some particular concerns about those from ethnic minority groups who may have more worries about getting the COVID-19 vaccination. So the government's decision to make it mandatory for those staff will ruffle a few feathers in the sector, but it will be coupled with an announcement of a consultation into compulsory vaccination for NHS staff too, because there's also a fairly significant number of people who work in the NHS who are not vaccinated. And we've heard from the Health Secretary previously about the fact that surgeons, for example, already have to be vaccinated against some things in order to work in that particular sector. Now, I think that will be the trade-off, because the consultation with the care sector said that it would be something they would be willing to accept as long as it stood for NHS staff too, not that care home staff were singled out. So this second consultation for the NHS more broadly will be really important in order to get everybody to agree that this is a good idea. But whatever we say about it, it will be controversial for some who believe that they should have the free choice about whether to be vaccinated or not. And in fact, that many around the country are already taking up that offer, including lots and lots of young people too. As soon as they get the offer of the vaccine, the take-up is pretty high across the UK. So there will be those who question whether it's needed at all.
OK, Kate, thank you very much indeed. Certainly a discussion point